health is an important thing. And I want to say that health is defined differently. But I wanted to look at healthy people and WHO. They both think that health has got to do with the general, social, mental, and physical well-being of a person. And so without good health, people talk about diseases, talk about ailment, talk about illnesses. But then people also know about good health, and they really like good health. So today I want to strike some nexus between climate change and health. And I want to say from the beginning that climate change negatively affects health, affects human health, affects plant health, affects even animals, and it affects even ecosystems' health. So you can imagine human beings, people get sick and people even die from diseases. Animals also get diseases and they die. And plants also wither and plants also die, in quotes. And even the ecosystems. We talk about the ecosystems' health. So we are talking about climate change as a bit detrimental to health generally. But we are also saying that if you look at it in the context of climate change, you would easily say that there is some level by which we can say climate change improves health, particularly what we are calling the co-benefits of climate change, with all the health co-benefits of climate change. For example, if we were to respond to climate change by mitigation or adaptation, particularly by bringing in sustainable mitigation, adaptations, or intervening for health, particularly using those approaches, then we would really have gained a lot. So climate change is known for the negativities we are talking about. Look at air and water pollution, for example. So many systems depend on air. Many systems depend on water. The moment there is a problem with air quality or water quality, you know very quickly that we will have negative impacts on humans, negative impacts on animals, and negative impacts on plants and even ecosystems, as it were. So then climate change, particularly what we have been able to speak generally, is that it leads to extreme weather. And this extreme weather will affect health because it affects the physical, the social, and mental well-being of people. Look at the physical health, look at the mental health, look at the social well-being, as it were. So then when we define the health as a social, mental, physical phenomenon, then that is what we are talking about. But we know that climate change affects almost everybody's health, particularly, but more specifically, it does affect the elderly, it affects children, it affects people from low-income areas, as it were. It also affects women much more than it does with the men and all that. And it also does affect people with pre-existing health conditions that we are talking about.